Hi everyone, this is JAYHERROD again. Up at Fort Carson, Colorado Springs. It is Saturday afternoon, October 24th, 2009, and this is for those on YouTube who wanted to hear my verbal JAYHERROD's proposed reform health plan. It's going to be a lengthy one. It's 2 pages, but I wanted to hear it, so here goes. Doctor's restrictions in treating patients. That's number 1. A doctor shall be allowed to treat a patient as she or he deems necessary, including the use of experimental treatments. In no case shall government interfere with a doctor when in treating a patient. A. Experimental treatments. A doctor or his or she's nurse must explain and provide in writing the risk of a said experimental treatment, including possible side effects, and patient must then sign that a statement that he or she understands, and then sign an agreement stating that no lawsuit against a doctor or medical facility can be made. B. Experimental medications. A doctor or he or she's nurse must explain and provide in writing the possible side effects of said prescription, noting also that it is not yet fully approved for treatment of said patient's condition, and then sign an agreement stating that no lawsuit against the doctor or medical facility can be made. Referrals. A. Doctors. Doctors can do a referral to a specialist with no restrictions. B. Patients. A patient may do a self-referral at no cost if the doctor refuses to do so, but must inform their doctor they are doing so. 3. Second opinions. A. Doctors. A doctor may refer a patient for a second opinion if requested by a patient. B. Patients. Patients may seek a second opinion from another doctor without the consent of their doctor at no cost to the patients. Specialist. Doctors. A. May refer a patient to a specialist without restrictions and at the request of a patient. B. Patients may go see a specialist if the doctor refuses to send them at no cost. Dentist. 1. Dentists shall be allowed to treat their patients with no restrictions. In no case shall government interfere with a dentist when treating a patient. 2. Coverage for dental office visits shall be the same as that of a person seeing a doctor, specialist, and etc. Page 2. Determining who will have to pay and not pay, individual and married. This shall be determined by the following. A. Income after taxes and all expenses regardless of income above the poverty line. If expenses are at least equal to income after taxes, pay for medical help shall not be required. B. Those who do not meet this requirement shall be charged only a minimum percent so as not to bankrupt a person or a married couple. C. Those at or below the poverty line shall not have to pay. Insurance. Who will not be required to have it. No one regardless of income shall be required to have insurance. Companies regardless of size shall not be required to carry health insurance on their employees if they either choose not to or cannot afford it. Grievances. A grievance board made up strictly of health professionals shall handle grievances from A. Doctors, dentists, specialists, nurses, nurses' aides, technicians, and others employed in the healthcare field. B. Patients. Funding for healthcare schools. 1. The government shall provide funding for schools that teach students in becoming doctors, dentists, nurses, aides, technicians, dental assistants, and other health-related fields. 2. This funding will include the pay of teachers that equals their field of expertise if they were not teaching. Now, anyone who wants to add to this can, and we can always change it from Jay's proposed reform health plan to People's proposed health reform plan. And that way, we'll all get the reform plan that we want. I'm not perfect. I don't pretend to know everything. This is open for discussion to be added to. This is Jay Herrod again up at Fort Carson, Colorado Springs, honoring the request of those on YouTube who wanted this. Thank you.